Are you an OT looking for practical strategies to help individuals with SCI in bowel and bladder management needs? If so, you are in the right place. With 40% of adults with SCI rating neurogenic bowel and bladder as a moderate to severe life challenge, dedicating just a few sessions to maximizing toileting independence can make a huge impact on your client's quality of life. This video series focuses on the role of OT in bowel and bladder management, or BBM for short, in the inpatient setting. But no matter where you practice, BBM is an ongoing process that requires adjustment and refinement throughout your client's recovery journey. So, if you're ready to level up your skills and make a real impact on the SCI community, keep watching. Hi, my name is Julia, and welcome to this educational video series on the role of occupational therapy in bowel and bladder management, specifically in individuals with spinal cord injuries. This 9-part series was developed in collaboration with licensed healthcare professionals and individuals with SCI who have generously shared their insights, tips, and real-world strategies to help bridge the knowledge gap in BBM training. To make it easy to navigate, you'll find a complete list of the videos linked in the video description below. If you're already well-versed in BBM and familiar with the different types of neurogenic bladder dysfunction, feel free to skip ahead to video 4. However, if terms like reflexive versus areflexive bladder, or upper versus lower motor neuron dysfunction, or bulbocavernosus reflex aren't part of your everyday vernacular, I recommend watching the full series to get the most educational value and to maximize your understanding of BBM. Let's dive in. So why is BBM so important for individuals with SCI, and why should it be a priority in your plan of care? Roughly 30% of individuals with SCI are readmitted to the hospital within their first year, with an average length of stay of 18 days. On top of that, 34% are readmitted to the hospital more than once due to secondary genitourinary complications. Beyond the inconvenience of frequent hospitalizations, research shows that adults with SCI report a reduced quality of life due to poor management of neurogenic bowel and bladder. And that makes sense. Being dependent on toileting every 4 to 6 hours can significantly impact engagement in activities, community integration, and overall independence. So where does OT come in? If you've worked in an inpatient setting, you know that OTs play a crucial role in the interprofessional team. Our job is to identify and address barriers to participation in ADLs, which in this case would be toileting and toilet hygiene, while nurses focus on the medical aspects of BBM. OTs are essential in ensuring that these clients develop the skills needed to manage these programs long after discharge, whether that's independently or with caregiver support. How do we do this? Barriers to successful BBM can often be identified in your standard OT evaluation and further explored using occupational performance analysis. So, throughout this series, we will cover different types of neurogenic bladder and bowel dysfunction, how management strategies vary based on function, how to assess bladder and bowel function from an OT perspective, intervention strategies, and adaptive equipment for males and females to support increased independence in toileting. By the end of this video series, you should feel more confident in evaluating and assessing neurogenic bladder and bowel, developing tailored BBM goals and a plan of care based on each client's unique needs, implementing intervention strategies, and incorporating AE to improve toileting independence. Most importantly, you'll feel more prepared in training individuals with SCI in essential BBM skills that improve their daily function and quality of life. Why does this matter? Because better OT training leads to improved carryover of toileting skills post-discharge, fewer hospital readmissions related to secondary genitourinary complications, and finally, increased independence and a better quality of life for your clients. Now that we've set the foundation, head on over to my next video, where I explain why knowing your client's neurogenic bladder type matters and how it directly impacts their bladder management program. See you there.